Hello Roadrunners. In our first video, we learned about the 3 C's of supportive care. Check, call, care. In this video, we'll apply the 3 C's to heat illness or heat distress. Heat distress is the most common problem you might encounter while running in a hot and humid environment like San Antonio in the summer. Heavy sweating can result in extreme loss of fluids and electrolytes and an abnormally high body temperature. Heat distress takes 3 forms: heat cramps, heat exhaustion, heat stroke. Heat cramps, as the name implies, are uncomfortable, even painful muscular spasms. Heat exhaustion means the body is overheating. Heat stroke is a life-threatening failure of our body's cooling mechanisms. So heat distress exists on a continuum between discomfort and danger. Without proper care, even mild forms of distress can escalate into something more serious. Now, let's use the 3 C's, check, call, care, to look at each, beginning with heat cramps. Check for the signs of heat cramps, which include muscular spasms in the gut and legs, and the victim may be feverish with flushed, moist skin. Calling 911 is usually not needed. Care for heat cramps include getting the victim to rest, giving the victim fluids and electrolytes, and massaging and stretching the cramped muscles. Continue care until the victim improves. However, call 911 if there is nausea and vomiting, which means the problem is more serious. Now let's turn to heat exhaustion. Check for the signs of heat exhaustion, which include general weakness, dizziness, a weak but rapid pulse, pale, cold, and clammy skin, and heavy sweating. Care for heat exhaustion includes getting the victim to rest and getting them into a cool environment, giving the victim fluids and electrolytes, loosening or removing clothing, applying wet cloths, and dousing with cold water. Call 911 if no improvement or if there is nausea and vomiting. Now let's talk about heat stroke. Remember, heat stroke is life-threatening. Call 911 immediately. Check for the signs of heat stroke, which include confusion, weakness, a rapid, strong pulse, skin which is hot, red, and flushed, and may be either moist or dry, nausea and vomiting, and sometimes unconsciousness. Call 911 as soon as possible. While waiting for paramedics, provide care by getting the victim to rest and getting them into a cool environment. If they are conscious, give the victim fluids and electrolytes. Loosening and removing clothing, applying wet cloths or ice packs, and dousing with cold water. Continue care until paramedics take over. If you want to learn more about first aid, watch the other parts of our video series. In the first video, we learned about the 3 C's of supportive care. In our next video, we'll learn about first aid for heart attacks, breathing issues, and how to perform basic CPR. In our final video, we'll learn about first aid for injuries from falling or collisions. And of course, you should consider taking a first aid CPR course. Just Google first aid training near me. Thanks for watching. Someone's life may depend on you.